I am ACS-YA's Walnut High School chapter, and future goals. I want to major in environmental science. That's about it. You'll hear from Angela, who definitely knows way more about what she wants to do in the future. So yeah, I'll maybe go into more detail when we talk about our club later. So stay tuned.
So Claire kind of introduced me, but hi everyone, my name is Angela. I'm also a junior. I am the co-president with Claire for the Walnut High School ACS Club. Like she mentioned, I kind of have a lot of ideas for what I want to do for the future, but we will wait and see how realistic those things are. I would like to go into like the research and physician aspect of like science, I guess, because I myself, I'm a cancer survivor. So studying kind of how it affects people and what we can do as scientists to maybe improve those outcomes or make it so the treatment is easier is really important to me. So we'll we'll kind of see how it goes, and hopefully all goes well and I'll be able to make a bigger difference in this world. So I'll pass that on to Swanika.
Hi, I'm Sonika. I'm a freshman that attends San Diego High School, and I've been with ACS-YA for about a year now, and I hope to continue for a long, long time. So my goals are to major in the medical field, maybe become a cardiologist, and I want to impact the world by helping others for like most of my life, and I want to spread cancer awareness and help other youth and young people in the world.
Okay, so let's talk about what are some of our objectives for today. Obviously, we want to talk about advocacy, but active advocacy, right? So we want to be participating, we want to be listening, we want to be learning. And then we also want to try and understand what are some things that we can start doing now to help prevent cancer in the future.
Okay, so quick breakdown. I'm gonna assume most of you here are with ACS-YA because this is the ACS-YA Youth Health Conference. But in case you are unfamiliar with ACS-YA and are, one of the youth participating in the event today, here are just some ways that you can get involved. So, we have active participation, which you're doing right now because you're right here. But obviously, we don't want you guys to kind of just sit here and stare at the event. One, because that would make me really uncomfortable, and two, because it would actually make this event fun. And two, of course, volunteering. You guys are never gonna believe what you guys are doing here today. Three, leaderships and skills training. So that's kind of a big part of our ACS-YA program. We engage in a bunch of different events, and hopefully you guys are able to, of course, learn more about just cancer and like all sorts the different fields involved in it, but also get to know other people and just be able to expand your horizons. We also being an advocate, which I guess kind of goes under what I was just talking about, as well as fundraising for a cause. This is kind of more so for, say, like clubs or chapters of ACS-YA, but of course, we want to be able to raise money for the bigger American Cancer Society because they obviously do good work that helps cancer patients in the US. Follow and subscribe. This is just pushing our social media. But guys, do you guys know that ACS-YA has an Instagram? I know, crazy. You guys all love Instagram. You guys are less screen agents. So, guys, like and subscribe. You gotta hit the follow button. And then, but the most important part I want to push is to get the word out because ultimately, like, you're all here because you probably heard about this program from like maybe your mom and dad or like one of your friends and you thought it was interesting or even if you didn't you still came here anyway so either way if you maybe know someone who might be interested in this program, they're interested in just going to the like interested in cancer, interested in public health, just anything along those lines, then you never know until you actually tell them, and who knows, maybe they'll actually be interested. And that's kind of the best we can do, honestly. It's just really just keep expanding and letting more people know.
All right, let's go over our agenda for today. So right now we're in the first part, which is welcome housekeeping, and we'll also talk about a scholarship opportunity. Then we will acknowledge some of the people that made this event possible, and we'll also present some certificates on behalf of ACS-YA. After that, we are very fortunate to have the City of Monterey Park issue some certificates to some of the outstanding volunteers that helped create this event. And then we'll have our first keynote speaker, Dr. Trevino, on her kind of like what she does and a little bit about her job, I guess. And then me and Claire will talk about our club and also kind of talk about youth advocacy. And then after that, we'll have a youth nutrition speech. And then after that, we'll jump straight into another talk, and it'll be about like tobacco, stopping that, and also kind of like how it's linked to cancer. And then we'll have a little prize game show, which I'm sure everyone's so excited for because we have some prizes to win. So pay attention to each speaker's presentations because maybe it will help you later on. We'll also have some research or like leadership career opportunities, like kind of highlights. And we'll be hearing from 3 different people today. And then that will pretty much be the end of today's event. So I'm going to pass on to Tonica to talk about some housekeeping.
So some very basic general housekeeping rules would be like to mute your microphone and try not to have background noise if you're online, right? Like on our Zoom meeting. We encourage you to take pictures and turn on your camera and like participate, like ask questions. We will record our sessions and we will be taking photos and a few videos, like some photographers around the room. And this will like help increase our cancer awareness and we'll be just generally taking a lot of photos. During the meeting, you can ask questions and you can use the chat box to ask questions through Zoom. And towards the end of the conference, we'll have a survey and you please give us feedback. And if you need to leave, please wait after like the speaker's done speaking or after we're done with questions. Okay.
Now, I would like to invite Sophia to come up and talk about our scholarship opportunities. Sophia. Oh, yeah, probably come up and talk about this. I will leave the 2 of you.
Okay. Hello, good afternoon. Thank you guys for coming. Guys, thank everybody for coming. You know, sometimes say guys, we got the girls. This is wrong. Okay, no, so I'm Liu. I'm American Cancer Society volunteer since year 2000. And I've been running Relay for Life. For my city of Royal Hills, and then I came here to do a Chinese Relay for Life. Because at the time we found there was no Chinese people running here. The American Cancer Society was only one of the services that taking patients to treatment and conference, over the phone presentation. So we started Chinese Relay for Life, and we found a lot of youth volunteering. So we would like to help the youth to learn about cancer prevention and advocating to tell the peers about health programs. And so we decided to start some youth program. And so we have been doing, we started the ACS-YA, we started the youth conference during pandemic because all the youth were, at home. So we tried to reach out to them. So we started youth conference online first. And now we are live because people want to network and we feel it's wonderful. We want to know each other. And so and I wanted to start a scholarship program. I really want the youth to participate and I want to award them for what they do, for volunteering for us. So when I reached out to actually my son-in-law, so he has a foundation that for youth, specifically for youth. So we applied for a grant. So we were able to get it last year and this year. So we started a volunteer program. So, no, I'm sorry, scholarship program. And we will want to award youth that does a lot of volunteer work, either inside or outside our program, and also doing leadership job, because a lot of people are afraid of leadership. You need to have, you need to learn how to do work, leadership. You may have certain quality, but you can learn how to do it and to be responsible to do what, to think about what to do is better, to think about what things to do as a leader. So we want to award those youth who is willing to take on the leadership. So we started a scholarship program. So our first prize scholarship is $1,000. So it's pretty good for if you want to go to college and things like that. So I hope you will consider participating and look at the requirement. Okay, so basically, you want to have certain volunteer hour, but also actively participating in our volunteering work and also take on leadership work. It can be as easy as, volunteer to do a flyer. We have very few people who do flyer. We love people to do flyer. It can be as simple as that. As we can see, we have a lot of volunteers. There are all kinds of volunteer work. So, I wish you can participate and volunteer and support American Cancer Society of getting volunteer hours. We started a youth recycling program. So youth can do recycle work and you can sell your recycled thing, right? And then get money, then donate to the American Cancer Society. And just by doing that, you can earn volunteer hours. So we actually have quite a few youth who did that and earn volunteer hours. It's a pretty easy way of supporting the environment and the community and also American Cancer Society. If you give money to American Cancer, where do you get the money? And that's one wonderful way you can do something for the environment and also support American Cancer Society and earn volunteer hours. You have these three advantages. Okay, so anyway, thank you for coming and I wish you can join our program and earn scholarship. Okay, so this is just a sample of our swag today. When you leave, we'll give you a swag. Okay, but you kind of. So we're trying to do things for you, right? We're doing a lot. So anyway, there was a presidential award, remember? And so everybody wants to earn ours for presidential award. And it's in a pause now. Is it the right time to talk about it?
Yeah, sure.
Okay. So it's supposed to be on pause. So we were helping you to earn presidential award, but it's in pause. So we decided to start the American Cancer Society Youth Award. So this year we made our own medal and it's designed specifically for us, very beautiful. You get a certificate. So, you can apply for Youth Service Award from American Cancer Society. Okay, YA. And then, of course, this is the swag we're making this year because we. Oh, a model. Because of the strength my son-in-law gave us, so we were able to buy you a swag, and so you can carry this bag around when you leave. Okay, thank you.
So I believe the next section is going to be actually headed by one of our online MCs, but let's see if we'll be able to get that. Our next portion will be basically our acknowledgement section.
I think how to put this.
Will we be able to hear her at least?
Speakers here. Speakers here. So I was thinking like this. I'll speak right? Just speakers. Just play this song.
Okay, just from.
Sorry, we were facing a little technical difficulty since we weren't able to test this ahead of time. But give us a little bit of time to just try and fix this. Sorry, everybody.
Speaker. Excellent. Okay, so can you make the Zoom play the sound? What? Can Zoom play the sound on this right here?
Yeah,
This is his computer.
I don't know, just say sound.
Oh,
We can test it. We'll test it.
Okay, Ira, we're ready for you to go ahead and talk. Can you just test and then we'll see if this works?
Okay, yeah. Hi guys, my name's Ira and I'm a sophomore in high school and I live in Frisco, Texas. And I I'm here
Hold on,
to
Ira, we can't hear
thank
you, sorry.
Can y'all hear me?
No, there's not even sound coming out from here.
Yeah, they connect to the. But you just try writing yourself on the Zoom and just see what happens.
We're gonna try to connect with the phone and then hold the phone up too.
Okay, yeah.
When I first connected with guys on this,
Okay.
我在这个方式对，yeah, disconnected.
All right, okay, Ira, go ahead. There might be echoes, so sorry.
No, you're good. Hi, my name's Ira and I'm a sophomore in high school and I live in Frisco, Texas. So I'm pretty far away from California. This is my first ACS-YA event. I'm really excited. And I'm I'm an ambassador and I'm a part of the healthcare career pathway community and I'm interested in a career in nursing. And then today, I want to thank our collaborations and sponsors, which is City of Hope, American Cancer Society, Sahas, and a couple of others, like ACS-Y, WHS Club, and Flying High Foundation. I want to thank all these sponsors and collaborations because without them, this event would not happen. So thank you.
Okay, so thank you so much, Ira, for introducing our collaborators and sponsors. So next up, Mark, can you come and talk about the volunteer certificates from ACE?
So hi, I'm Mark Shen. So I'm a sophomore at Torrey Pines High School, San Diego, California. Um, so I've been a part of the American Cancer Society Youth Association recycling program. So basically, I went around collecting like, plastic bottles and recycling them. So after like recycling them, I used the funds made from recycling bottles I donated to American Cancer Youth Society. So which amounted to like around 160, like 106 volunteer hours. And I'm passionate about cancer prevention because I want to like help end the suffering that like cancer brings and also like end the emotional distress it can like bring to people. Um,
So now we're going to recognize those who have basically gotten a lot of volunteer hours over this past year. We're gonna hand out some certificates. I would first like to remind everyone here today, please make sure to log your hours because you know, the people that will be receiving awards today, that could be you a year from now. So make sure that you're always filling out the volunteer tracking form after every event and you know, if you're doing something maybe at home, maybe you're designing flyers, your contributions. So, Lynn, I believe you're presenting it. Okay, so I'll invite you back up then.
Okay, so I talk about the certificate, the volunteer hour program writing. So, let's see. So we have three. Um, three people we're going to recognize? Four. The last one? Okay, so this criteria of award, bronze award, for teenagers 11 to 15, 50 to 74 hours. For young adults 16 to 25, 100 to 174 hours. And silver award for teens, is 75 to 99 hours. For young adults, 175 to 249 hours. And the gold award, 100 hours up for teens and 250 up for young adults. So, the first, I think I'll give the gold award first. The gold award, is, Claire Chen, and she accumulated total 333.5 hours. Everybody's calling me. And the second gold award is Sammy Zhang, and she accumulated 256 hours. Okay, thank you. And the third award is silver award for Angela Yunayan, and now she's a cancer survivor. I'm amazed she can do so many hours. And she total 187.75 hours. Okay, thank you.
Can I get everybody who got a certificate to come up and we can take a group picture together, please? Link, don't run yet. We still need you. Thank you so much. Okay, let's move on. There's more certificates to come. So now I would like to say thank you first of all to the City of Monterey Park for, doing this, but I believe we have some certificates and maybe a few words.
Yeah, thank you. Hi, everyone. I'm Elizabeth Gang, Mayor of Monterey Park, and it's my pleasure and honor to be here representing the city to present some certificates to the leaders and volunteers that made today's conference possible. I think this American Cancer Society Youth Ambassador Conference is such a great event for the community. So it wouldn't have been possible without all the students, adults, parent volunteers that dedicated their time today. So if I say your name, please come up. I have 12 certificates, so we won't do it individually. We'll just do one big group picture. Richard Su. Claire Chen. Angela Unayan. Mark Shen. Vincent Frisch. Please stay up here. Zero Chu. Demi Zhang. Yun T. Lin. Jia Yang Su. Aryan Mukherjee. He's not here. Not here. Krish Kohli. And the last one is a adult advisor, Apurva Vishwanath. I'm gonna take it on. Both, okay. If you guys certificate, feel free to come out or make your picture.
This way. Move this way.
Okay, 1, 2, 3.
Okay, we also invite the speakers to come here for the group picture together. See the four speakers, please. The four, Dr. Trevino, Dr. Monroe, and Thomas. Don't stand in the middle with, everybody know. Yeah, love that.
Okay.
Closer. 1, 2, 3. Thank you so much.
Thank you.
Can you go to the next? Actually, I don't. So incompetent. Okay. Wow, that's me. Hi, guys. So, I mean, you guys have already heard about me, and I'll probably actually go into more detail about introducing myself, when it comes to talking about the club. But for now, I would like to introduce our first keynote speaker for today, Dr. Trevino. So just a quick introduction, she'll probably also introduce herself, but she is an associate professor of the Department of Population Sciences at City of Hope, and today she'll be talking about environmental pollution in regards to cancer incidence. So without further ado, can you guys just give a warm welcome to Dr. Trevino.
That's the first slide. Okay, hi everyone. While we're figuring this out, I just want to say thank you so much for the invitation to speak here today. I have never heard of this program and I feel embarrassed about that because this program looks amazing. And just a second, do you have separate slides I can wanted to show? Yeah, but they told me to send it. Sure, you know. Okay. Sorry. Their slides are coming. Yeah, so I'm a little embarrassed about that because I work at City Hope, I have a certificate program, and you all are doing such fantastic work. And so I just want to applaud all of you for all of the work that you're doing, all of the volunteering that you're doing, all of the outreach and the advocacy that you're doing. And I also would like to say something that, because it's near and dear to my heart, we're talking about the environment, we're talking about pollution, we're talking about that. And so not only is there a connection to cancer outreach and education, but you all are doing things also related to the environment and trying to make
Just now you already pulled it up.
trying to do
Yeah.
advocacy.
No, that was just the
And
introduction.
so
That wasn't.
I just want to say thank you so much, all of you, for starting so young. When I was in high school, we didn't do these kinds of things. I grew up in Texas. And so shout out to the person who was from Texas who gave us that little,
You did it
who
right
had that
first
little
slide.
section. And so we didn't have any of these kinds of programs when I was growing up. And so I think it's amazing that all of you are here today, doing the things that you love. So.
I think so. Yeah, sorry.
Okay. Okay. It looks a little wonky, but that's okay. Yeah. Yeah, right, from the general title, but I call it From Planet to People and how environmental pollution impacts cancer and health equity, because it's really important that we think about our health, the health of our family members, the health of our communities, in the context of the health of our planet as well. And so the first part I will talk about is environmental pollution in general. And so I have here just a little bit of background about sources of air pollution from the outdoors. So we're talking about the environment, the air that we breathe. Basically, sciences defines air pollution as a mix of hazardous substances from both human-made and natural sources. So what are some of those sources? Here, some of it is natural, so from volcanoes, from lightning, from wildfires, all the wildfires aren't always natural these days, unfortunately. But also from farming, so fertilizers, emissions from livestock, oil and gas, extraction and processing is also another source. We also have our industry, power plants, sewage treatments, so some sources of pollution come from there. And then we also have how we get around, so transportation, right? So cars, trucks, buses, motorcycles, airplanes. It's like there are so many vehicles emitting so much pollution around the globe. And our cities. So the things that we do, the things that we build also impacts the air that we breathe. And so I will, just because this is a short presentation and I wanted to leave time for questions, I will focus on some case studies or examples for particulate matter 2.5. And so this is just one type of pollutant that you may find in the air, in outdoors, and also indoors, which we'll talk about in a little bit later. And so PM or particulate matter 2.5, these are really, really tiny, fine inhalable particles. And they're called PM 2.5 because they're 2.5 micrometers or smaller. So if we look at the diagram on the right there, that's showing a depiction of the width of a human hair, which is 50 to 70 micrometers on average. And so PM 2.5 is even smaller than that. And so that little schematic just shows you how tiny these particles are. And main sources include power plants, motor vehicles, airplanes, residential wood burning, forest fires. So this is just one example of the chemicals that are found in the air when we talk about pollution. And so this is a graph, I hope that you can see it, from California State. They have this thing called Cal Enviro Screen. And so you can actually go and you can look at maps of where pollution is based on where you live. And so I zoomed in here. This is Los Angeles there. Here's Long Beach. So we're in this area-ish right there. Here's Monte. You can see that, too short. But so this is the area that we're kind of in right now, right? And you can do the same thing for anywhere else in California with this map. And what we're showing here is that the orange circles are where there are PM 2.5 monitors. And then the color of blue shows us the percentiles of how much PM 2.5 is being monitored in that area. And so the darker the blue, the higher the levels of PM 2.5. And so you can see in our area, there are pockets where there's a lot of this PM 2.5, where it's like greater than 90 to 100% percentile, right? So we live in a very polluted area, we'll say, right? And I probably forgot to mention, but I'm also in the division of health equities. And so we think a lot about what things like this might mean in terms of which communities are impacted, which groups of people are impacted. And so this next graph shows, again, from the Cal Enviro Screen, what they call vulnerable communities, right? And so they look at socioeconomic background, they look at where people of certain races and ethnicities live, and they decide, or they are able to map what are called vulnerable populations, right? So the most vulnerable populations are in red, based on this analysis. And so you can see that the areas where we saw a lot of dark blue, we also see a lot of red. And so this is an environmental injustice issue too, because we see a lot of pollution in neighborhoods where people are already vulnerable in other ways, right? And maybe they're not able to kind of fix the solution on their own, right? Maybe because there's low socioeconomic background, or there's all kinds of issues that these vulnerable communities might also be dealing with on top of the pollution. So I just wanted to show that there's that overlap, and you see this in a lot of different places around the country. So the EPA has a similar screener. It's not working right now because of what's going on in the government and everything. It's not really working that well. So I focused on California for this presentation. And so then the other thing that we can do with this data is we can ask, like I mentioned, different groups might be more vulnerable, right? And so you can also break apart some of this data by looking at the pollution burden by racial and ethnic group. And so this chart shows the different races and ethnicities. And so on the blue bar, for example, is white. And then you have in the green bar Asian, you have Native American or Indigenous in the orange, and Pacific Islander in the red. And you have Black in the yellow, and you have Hispanic Latino in that pink color. And so it's pretty obvious from this graph that everyone else that's not white has a higher pollution burden in the state of California, right? And it varies depending on the groups, right? But it really paints a picture of who is being more impacted by the pollution that we have. And this is again that air pollution that we're talking about. And then if we look at kind of a different way to look at this, on the left-hand side, the selected neighborhoods, you see that 67% of the least impacted neighborhoods are white. And if you look at on the right-hand side, the 10% most impacted neighborhoods, then 91% of those neighborhoods are where people of color live. And so this is something that we think about all the time in my lab and in my research, even though I do laboratory research and I use cells and I use animal models and some patient samples to do some of the work that I do with my team. But we think about this all the time because this is not just like a scientific issue. It's like a humanity issue, right? It's like, what can we do to help educate and tell people, especially in the communities that are all vulnerable, about the things that they can do to help protect their health, especially when it comes to this pollution burden. Okay, so that's just a little vignette about outdoor air pollution. And I'll talk a little bit more about how it relates to health in a little bit, but I also wanted to talk a little bit about indoor air pollution. So how many of you think that outdoor air pollution is higher than indoor air pollution? Again, a show of hands, outdoor higher than indoor. Okay, that's some people. How many of you think indoor is higher than outdoor? You've got some, okay, some. How about if I told you that indoor air quality is worse sometimes than outdoor air quality? It can be 2 to 5 times higher pollution in your house than outside, right? And so people don't think about this because we all know about smog. We live here, if you live near Los Angeles for sure, right? Like what is that? Sometimes I think, are we on fire again? And I'm like, no, it's just the smog. So we all know that and we can see that. And we can't really see what's going on in our homes, right? But it can be higher indoors. And so what are some of the sources of air pollution indoors? So this little schematic just kind of breaks it down a little bit. Chemical release from the actual materials and furnishings in your house. So whatever your house was built with, it's off-gassing chemicals. Whatever furniture that you bought is off-gassing chemicals, likely, right? Even for people who have pets, animal hair and dander, that impacts the quality of the air inside your house. Chemicals from cleaning products, right? Like has anybody ever looked at the back of the bottle? And then we were just talking about this, right? Where it's like you can't even pronounce some of the names of these chemicals. It's crazy, right? And it's just this long whatever, and it's like I don't know what that is. That could be contributing to the poor quality of air in your house. There is also particulate matter, like I mentioned, from gas, if you have like a gas stove, from cooking. And then if you have like paints or solvents or anything like in the garage or something like that all can come into your house as well. If you, again, from the garage, like fumes from your car, right? Like once you drive in and you park, and if it's attached to your house, all of that exhaust and everything, that's all coming out of your car into your house. If you or a family member, hopefully not a whole bunch of people in this room, because you all know about tobacco cessation and, but if anyone smokes in your house, right? Like that's the source of chemicals there. Outdoor air pollution, that comes in as well, right? So there were studies that showed that during the wildfires, the indoor air pollution in certain houses where there was wildfire, went up, right? Skyrocketed. And that was, I think they said something like even within a 2-mile radius. So you didn't even have to be like right at the site of the fires to be able to have the quality of the air in your home get worse because of these fires. And then we also have gases, including radon, that come in through the foundation. And so that is like natural, right? Because it's coming from the earth. And so there's not a lot that you can do about that except monitor it, right? So like you have radon monitors and things like that in your house. Okay. So I mentioned particulate matter before. And so what are some of the sources of particulate matter as our example today? Indoors. So cooking. Activities like broiling, frying, grilling, or using gas stoves. I have a gas stove. I like the way gas works. Like I just like it, right? Like you can control it. It's nice. It makes your food feel nice, whatever, right? But we have to be careful because if you don't vent properly, all of that's in your house now, right? Combustion activities. Most people don't know that burning candles, especially candles with fragrance. So fragrance, big no-no, right? I don't use any products, or I try not to use any products that have fragrance, because fragrance is a mix of thousands of chemicals that they don't need to report what those chemicals are, right? So again, we talked about the cleaning products, air fresheners also, right? Same problem. There are also biological sources, mold, spores, dust mites, cockroaches, things that might be in your home, just the natural, not that your home is like dirty or something, right? But just kind of those exist. And then we talked about outdoor air, right? Which can enter buildings through windows, doors, ventilation systems, and small cracks and crevices. Oh yeah, I did have this. Okay, so I mentioned this, but now I have a graph to show that I'm not crazy and that it's actual data. But this was the elevated indoor PM 2.5 levels due to LA wildfires. So this was a study that they conducted at Harvard, but they put air quality detectors like in 1,000 homes. And then they said, okay, what happened? So this was the wildfires in January 2025. So before the fires, you can see that most of the homes weren't too bad, right? Mostly green, some red, very little. Some yellow and some very little red. But then during the fires, right, you could see that those levels jumped indoors, right? And so even if you tried to lock the windows, not open the windows, and all that, it was still getting in. And so I show this because we talked about, I'm not going to talk about climate change that much, but like the wildfires and climate change and how we take care of the planet and all of that. We're now seeing more of these extreme weather events. And so we're going to start seeing more and more things like this. And I know that there's a lot of people who are starting to study what are the health impacts of these wildfires and the exposures that we get during these extreme weather events, and we don't know the answer yet, right? No one can say, oh, we now know that the exposure to this particular fire is this, because we still have to do the data to look, like we still have to do the studies to look for that data. Okay, so I'm going to give you a cancer example and a non-cancer example about adverse health effects. And I think it's important to talk about the non-cancer example because there are so many different risk factors for cancer, right? And really it's like the general overall health that we need to be thinking about, our general overall health that we need to be thinking about. And so if we have some of these other diseases that may be caused by this environmental pollution or this air pollution, maybe we're going to be at increased risk for cancers, or we're going to have a worse outcomes when it comes to treatment for cancers and things like that. So, there's been a lot of work done on COVID-19 mortality rates. And so this is actually a really, when I saw this data come out, it was really disheartening because it's again, it's an environmental justice thing, right? Like it's just so terrible that something like this, which devastated a lot of communities just in general, like even had a bigger and larger impact when it came to the communities that had higher air pollution, right? And so this was a study in I think Keck School of Medicine at USC, where they looked at California death certificates to identify COVID-19 deaths. And so they did two different time points from March 2020 to March 2021. They looked at the spring and summer and the winter surges. And they looked at census tracts and what the levels of air pollution were in those census tracts. And then they tried to say like, okay, these places where there were high area, like high there was a lot of air pollution, what impact did that have on mortality rates to COVID-19, right? And they found that mortality rates were higher in the areas where they had long-term air pollution levels. And so you can see the numbers there. But I think that this really goes to show that we have this, it's like a perfect storm of disaster, right? Where it's like, you already have air pollution for whatever the reasons we have air pollution in this area, right? Or in the areas of California that they were looking at. And then you have a natural event come along, or you have, infectious disease come along and you have an epidemic of some sort, right? And then those populations that are already suffering with the impacts of the long-term air pollution are now even more vulnerable, right? And so I think I put this up here just to show that we're still trying to understand what could have been done, what can be done, and I think I even saw something that showed that the indoor air pollution, like, because the outdoor air pollution went down because people weren't driving when we were all kind of stuck in our house, right? So like the air in Los Angeles was like, oh, it looks great, right? Like you can see the skyline again, it's beautiful. But the indoor air pollution actually went up during that same time. So these are things that we should think about. And then because this is the American Cancer Society, and because I know that you all do a lot of work with tobacco and lung cancer and things like that, I've included this as just an example from this paper. I focused on the studies that were from the United States, but this table was bigger and it showed that this happens globally also. But this shows the association between particulate matter, PM 2.5, with lung cancer. And so there have been multiple studies that have shown that PM 2.5 levels are associated with all-cause mortality. So like for any reason, they are associated with lung cancer mortality and also cardiopulmonary mortality. And that 5 levels, you get an increase, an even higher increase in these mortality rates. And so I'm not going to read through this whole thing, but this is just to show you that it makes a big difference, right? We may not think about, oh, it's air pollution, whatever, what can we do about it? We live in Los Angeles, the traffic, what can we do? Cancer risk. And then I want to take it back because, again, I think about these things, right? But I want to take it back to what we know about lung cancer and lung cancer disparities, especially based on race and ethnicity. Thank you. And these graphs just show lung cancer disparities among Black individuals, Latino individuals, Asian and Pacific Islander individuals, and indigenous peoples. And so I'm not going to walk through all of these, but I will. White individuals and then the light blue bars are the ones for each individual race and ethnic group. And so if you look at early diagnosis, surgical treatment, and lack of treatment, almost across the board, every single ethnic group or racial group has less like early diagnosis. They have like fewer people are getting diagnosed early. They have less surgical treatment, so they're not provided the options for surgical treatment, and they have increase in lack of treatment, so they're not even getting any treatment whatsoever across the board. And so I remind you, these are the same populations, the people of color. I showed you that those numbers where they're also having the highest burden of pollution, right? So they have the highest burden of pollution, and then they also are experiencing these disparities when it comes to lung cancer. And we know that the pollution can increase the risk of the lung cancer. Then they're also not getting access to treatment. And so it's like a double whammy, right? And so my point here is that we all kind of need to work together, right? Like I run a lab, I think about mechanisms, and I love cell lines, and I love advocacy. I do advocacy myself. I've been in Capitol Hill, and I've spoken with representatives. And I work with nonprofit organizations that are doing a lot of advocacy work as well in terms of environmental chemicals. And so we all need to kind of work together, because it's going to take a village to fix this. And so I bring this up to you all so that hopefully you all will become part of that village. So, and now, no more air pollution, right? And so we'll start with outdoor. I talked about transportation. Where possible, choose sustainable transportation. Embrace reusable products, plastics, recycle, reduce, reuse, perfect, right? Because the plastics industry is a major reason we have a lot of these emissions, just from start to finish, because they rely on oil and gas, right? So they come from oil. Conserving energy, planting trees and greenery to combat. And then for indoor pollution, the main thing that you can do to help with this is source control. So first of all, eliminate where possible, right? Avoid using the candles, the fragrance, fires in your house. Don't use any of these camp stoves or any fuel burning appliances indoors. Go fragrance free where possible. Don't use and furnishings that do not contain formaldehyde. The other thing is, if you can't get rid of everything, can you reduce, right? And this is just basically how often you vacuum and all that, and not using products that contain chemicals or these volatile organic compounds, and exhausting, using exhaust in the bathrooms during bathing and when you're in the kitchen cooking. And the other main way is ventilation, which is free. So opening your doors and windows for 15 minutes each day is one of the best ways to increase ventilation. It helps bring in fresh air. Just don't do it if the air quality is bad, or if there's airports or anything like that, or factories. So these are some ways that you can reduce that. So I hope that was informative, and I have time to take a questions. I have 5 minutes for questions. Yes.
I have questions. In your research, have you ever conducted research on the soil contamination? That because it doesn't look out and we products and it also affect our body.
Right. Yeah. So the question was about soil and soil contamination.
Yes.
And so that's a really that's a really good question. So I haven't done research specifically, so I'm not like a soil remediation person or specialist or anything like that. But I do know, right, that there are people doing research looking at the quality of the soil after the wildfires, because a lot of the flame retardants, like they want to put the fires out, they want to save your homes. It's very important, right? That's important work. And also a lot of those flame retardants have chemicals, and they stick around in the soil for a really long time. So there are researchers that are looking into that. And also, yes, there are some fruits and vegetables that pick up pesticides, right? Like, and they hold pesticides more than others because of how they grow, when they grow in the soil. Go to ewg.org. They have their dirty dozen. And so they have the 12 fruits and vegetables that are the most polluted. Like if you can, you get organic of those if you can afford it and if it's available to you. So they prioritize the list because not everybody can buy organic. It's like too expensive, right? But it's like strawberries.
This question is because soil contamination is hard to treat.
Yes.
It's because it's almost like we have to change the dirt.
Yes.
And also then I think besides the pesticide and then there's like a solar panel because we use the solar panel a lot.
Yeah.
And then when solar panel went out of their usable age,
Yes.
then we have a problem to recycle them.
Yes.
Yeah, and then it has the heavy metal
Contamination, the heavy metals.
contamination. So that is almost permanent and can pollute the air, soil. That's my main concern.
Yeah. No, I completely agree. So the first part of her comment was, so I think you bring up a really good point, is that like solar panels help with like renewable energy, but how are they being made right now? And how do we dispose of them when they're right? And so we have to think about when we have to think about these things and have more and more people working on this so that we know we need solar panels, we need renewable energy, and also it cannot be made with these things. So can we have cleaner alternatives? I do want to mention this, especially in California, we have lots of Superfund sites.
We do, yes.
Yeah, and the most recent example is in Orlando, which is Superfund site.
Yeah.
But government claims they created, and now they're building the master plan community on that. And I happen to find there's a hospital, a division, City of Hope, built right next to the Great Park. So I'm like, okay, we are really compete the land. California. That's why the previous Superfund site were allowed to build homes, people to.
Yeah, I don't want to get political, but I will say that that's why, this is why it's really important for people who live in those neighborhoods to be aware. Where are the Superfund sites? What are, because you can go to the mayor, you can go to your representatives and you can say, listen, I want to know that the tests have been done, that this is safe, because if it was a Superfund site 30, 40, 50 years ago, depending on the contamination, it may be okay. But it depends on the contamination, because some chemicals are like forever chemicals. Thank you so much for your comments. Yes.
I got a question because you showed a slide about like the aftermath of the LA fires and like the indoor pollution. How was there any data afterwards on how long that pollution stayed indoors from like the smog or smoke from the fire?
Yeah, I haven't seen any. So I was looking to see how long, and I think personally, I think it would depend on how much got into the home, and then did it stick to, like if you have carpets and things like that and you weren't. But I think that you have more control what's in your house, which is why it's very surprising that those levels can be higher than outdoor air pollution, because there's a lot of things that you can do to kind of clean your house and make sure that you're maintaining things so that if you do have a source of contamination, that goes away.
Thank you.
We have two more questions, but we have to stop. What do you want me to do? Okay.
So I have a question. Where can we find the data of like the PM 2.5 pollution percentile that you showed us earlier? And where can we find those data? And how can we advocate this data to more people? As you mentioned, you were involved in advocacy and yeah, like to just spread the awareness of like the pollution that's in the area that we live in.
Yeah, so that was from the California EPA. So they have a thing called Cal Enviro Screen, and that's where you can find those maps. So you can look at any part of California, and they have maps for ozone, for nitric oxide. They have different chemicals. I was just showing PM 2.5. So that's publicly available. You go to the California EPA site, and you can find that data there. You can play around with it. You can look to see what's going on there. And then for advocacy, yeah, there's a lot of organizations, like you could just look them, like you could just look it up and do a search, right? Where they're doing a lot of this, a lot of regulation for a lot of these chemicals. So we were one of the first states to ban, or to say that people who want to use fragrance have to tell us what fragrance is, right? And so there's a lot of stuff that California does bill-wise. And so for people who are voting age, it's really important to look and see your representatives, like your state representatives, and you can say, I'm very concerned about this, right? And I'll tell you a secret I learned on Capitol Hill, right? Every single email they get, they check and they have to respond. It's every month and they count it as 12. You count as 12. So your parents can write and they count. So every person that writes, they have to do because they work for us.
Thank you, Brady.
Yes, thank you. Okay. Yeah, I think so.
Yeah, thank you.
Oh, yes, so, yeah.
Oh, no.
Oh, yeah.
Thank you so much. Thank you so much.
Going back to this one.
All right, Claire, get up here. The next segment, since we reintroduced ourselves, we're gonna skip over that, but we will now talk about kind of youth advocacy and what we've done in particular to kind of show what youth advocacy could look like. So Claire's gonna handle this first part of the presentation.
Okay, so as Angela and I talked about about it doesn't matter what we talked about how we are co-presidents of Walnut High School's ACS-YA club. So if you were here last year, last youth health conference,
Later.
you might remember that we said that we started the ACS-YA club, and we did start that in our sophomore year. But to be quite frank with you guys, that was that didn't really go that well, honestly. And so one of our biggest problems when we were first starting the ACS-YA club was just that we at our school we have this event which is called club fair. So basically once you get all the paperwork done for setting up your club, the school gives you an opportunity. It's like a whole week to basically advertise your club, get it out there, just get people interested. And that's usually when all the people come in for the new clubs. And so that was great and all. So we got a decent amount of people at our club fair, maybe like 30 or so people who said they were interested. And our first meeting wasn't that bad per se, but you could still, but we had a cabinet size of around 5 or 6 people, and maybe like another, say, 5 or so members of the club. And so what happened was every one of our meetings, we would basically be talking about our goals for the club as well as some information about the monthly awareness. So, like for instance, you know, uh, we talked about we're going to talk about Lung Cancer Awareness Month for our club's next meeting. So we would do something like that. So the problem was that and I'm sure you all are like very interested in cancer awareness, so this might come as a surprise to you. But not all people really want to attend basically lectures for cancer awareness, especially when they just got off like say 2 to 3 hours of class and they just want to eat lunch and hang out with their friends. And so while we did want to, you know, give out information and obviously like have our club be very educational, the fact still stands that you know, people are getting off of lunch, they're tired, some of them are probably taking like AP classes and just had the worst test of their lives. And you know, we weren't super engaged, if I'll be super honest. And so by the time the end of the first semester rolled around, we kind of we were kind of doing really bad, if I'll be honest. And at the start of the second semester, we kind of not that we forgot about it with schoolwork anyway, second semester. So the club kind of just went inactive for the rest of our sophomore year. So then you know, after summer school. So picture me, it's like Yosemite, and I'm very scared to go back to school. And then Angela comes around and she's like, we should totally start the ACS-YA club again. And I'm like, wow, really? I'm a bit scared for my junior year, honestly, because this is like my first time taking 4 AP classes, and I hadn't taken an AP class before. But then I was like, okay, well, I'll go for it. So then we go for it, right? So Angela, she is like super sociable, and she knows like so many people. I'm just the biggest introvert you can find here. So she reaches out to a bunch of people, and so one of the first things that we did, when we were restarting the club was, well, find a bunch of people who could actually help us. Because the problem with our cabinet before was that we basically had applicants from like all people around the school who were interested, but we weren't exactly familiar with them. And so it kind of created an issue where like we weren't exactly having people who we could rely on to do something to execute our club's plans if necessary. And so that kind of contributed to the stagnancy of our club. So first thing we did was establish a strong base. And then we met up with those people. And from there, we started to plan out what we want to do. So we made plans for our club. We have like this one super big doc for our club, which is super messy. We should probably organize sometime soon, but it's there and it has basically everything you need to know about the club. I'm not sharing it because that's confidential. we organized what we wanted to do. And so now, all we had to do was just actually get people interested in our club. And so, and you can see here, we made drinks for Club Fair. And then we also had prizes for Club Fair. And so people were coming left and right during Club Fair because who doesn't love cold drinks on a hot summer-ish day? And also like stickers and cool trinkets. So we had a lot of people. Oh yeah, also look at those. If you guys can see over there, there are some flowers we made for our dear speakers today. And I think we are way more successful. We have about like 30 active members, including our cabinet now. So I just wanted to show off a quick montage I edited for our club fair. Because I edited stuff. I guess that happens.
Oh.
Guys,
The
sorry.
music might not work, so we're sorry about that, but
Yeah.
this is kind of what we were doing, and you can see we had like really big crowds of people, and those are some of the people that are actually in our club today, and it's been kind of like a journey of growth and learning for us as well. So it's very endearing to see all the people who came to support us. So yeah.
So, you know, in case you're interested in starting ACS-YA club at your school, which I highly recommend, just a few tips. Get a strong cabinet, know what you want to do, make your meetings engaging, and you know, have a strong start and have a strong end.
Okay, I know that we're almost out of time, but I'm just gonna quickly go over the other portion, which is about youth advocacy. So kind of the reason why we talk about our club in the first place is because we want to talk about youth advocacy and what we can do. And so obviously starting a club is one way, and it's a really good way to maybe tell your friends and classmates to come join you and do youth advocacy, especially is so important. It's really powerful because we are the next generation. We are the people that will end up contributing to society in the future. And so by being educated, by knowing and understanding what kind of societal issues we have, only then if we speak up. Let's talk about this. It's always going to be personal, and no, it does not have to always be about cancer, but it should be something that maybe you realize that there's a big environment, that could be maybe health, that could be maybe policy. All of those things are really important issues. And if that's something that you're interested in personally, talk about it, write about it, do something about it. It doesn't have to be big. It can be a small, a bigger impact on society. So again, that's kind of what I was saying. So what can you do? Again, we always talk about fundraising, and maybe you're thinking, oh, like, why are we always fundraising? Because honestly, like, not a lot of people really, while you're doing the fundraising, you're also kind of raising awareness. And sometimes the 2 in 1, you hit 2 birds with 1 stone. So, you know, those 2 things, they come hand in hand. And whenever we're fundraising for these things, maybe it's small actions. Maybe, let's say, if it's a health scenario, that you want to purchase more health products for a group that's facing disparities. These small actions can all lead to a greater impact, maybe influencing some more like wealthy or maybe influencers even to also want to take action and help you with your goals. Okay, so I would like everybody here to take a pledge. Can we look up at the screen? You see this little 3-sentence quote that I have up here? Can everybody please repeat with me? I pledge from this day onwards to try and make a difference in my community, no matter how large or small. I will take a stance as a youth leader to inspire others to take action as well. I will become someone others can look up to. So here are some things that you can do. Join ACS if you haven't already. Sign up for future service events. Follow our socials and choose prevention as a lifestyle and maybe influence others to also do so. Thank you so much. I guess the next section is still headlined by me. Okay, so our next speaker is Ms. Diana Tam. I believe she's not here today, and I think that we have a video recording. So I'm not too sure how we're gonna do that because it seems like we have some volume issues. So I will hand it to tech support to try and fix it. But in the meantime, let me introduce her. She's a project coordinator with City of Hope, and she basically talks about like equities in population sciences. So here her talk will be about like youth nutrition, and she'll be, aside from what she does at City of Hope, she's also kind of like working with the larger community to try and get advocates to basically promote these kinds of things. And so all in all, her main goals is to get people to be in progress. in terms of these goals that she has set. So I'm sorry.
Okay. No, this speaker. What? I know a speaker connected. Try. No, this one. I'm trying this one.
Yeah.
At City of Hope, we recognize that nutrition is a powerful tool in preventing chronic conditions such as diabetes and their lives. We're laying groundwork for healthier communities now and for generations. Over the past year, I've led. Okay, we're gonna try the phone method again. Sorry, everybody.
It was working. So,
Okay.
so now, oh my God.
Just try on the phone then. We cannot.
Is it working?
I'm not hearing anything.
Did you bring that?
I heard that part, but I didn't hear this. Over here, you can do it.
My name is Diane, Science Department here at City of Hope. I work closely with Sophia National to develop and implement community-based initiatives that promote health equity, with a particular focus on youth engagement and nutrition. At City of Hope, we recognize that nutrition is a powerful tool in preventing chronic conditions such as diabetes and obesity. By engaging youth at a formative stage in their lives, we're laying the groundwork for healthier communities now and for generations to come. Over the past year, I've led a youth nutrition education and leadership program, an initiative designed to empower young students to make informed, healthy choices and build lifelong habits that support their overall well-being. It's been incredibly inspiring to witness how our youth have embraced this program and not only applied what they've learned in their own lives to improve their own nutrition and wellness, but also become advocates with their families, sharing knowledge and encouraging healthier habits at home. I'm thrilled to share a few videos that showcase the creativity, commitment, and growth of our students. Their experiences highlight the meaningful impacts of the program and their understanding of nutrition in their journey towards a healthier lifestyle. Please enjoy. Thank you. Hi, my name is Sarah. How would like to visit the homes and she was learning so much about why certain things are important for our bodies and how to create healthier habits that we need. I think by healthier eating and lifestyle decisions, I really like the program. It was interactive, so helped me get out of my shell. And I made a new friend. Hello, my name is Christopher. I'm the officer for youth past years and the healthy nutrition course last June. And I joined because I just wanted to understand how we just impact not just our personal health, but also one of the biggest things I learned was how much processed and ultra processed foods affect our bodies over time. And during the course, they talked about things like added sugars, saturated fats, and sodium, and how all these are just major contributors to chronic diseases like heart disease, obesity, and type 2 diabetes.
Okay.
So second class, I've really started reading more labels, a little more carefully and cooking more meals at home in general since it's a much more healthier alternative than, fast food and whatnot. Another thing is I've also changed, like a lot of my habits, like eating habits and just things that were bringing me down. But I also share what I like with my family and friends, and especially about all small changes like sugary drinks or eating more whole foods can just make a big whole difference. What's something they learned? Something I learned was like about diabetes and how to prevent it and the different kinds of the stages of
This
it.
inverse is so hard.
And was there anything in the class that you took from the class that you taught others? Yeah, actually, got into an argument with my dad about which type irreversible, which it is not, and he was like, no, it's not, no, it's not, so he started to apologize. So we ended up the city of was basically therapy through dieting or exercising. We learned how to avoid diabetes and the listening with diabetes. My experience it was really educating for the people there that were helpful and like explaining to I've learned in my life by watching what I eat. I used to be pre-diabetic, but not anymore. And my aunt also because I started the diet when I told her why start fucking fast. So yeah. What I learned through food class is that just learning about the different food demographics in America and how there's a lot of disparities going on in a lot of areas, especially through Southern California, especially with racially related issues and a lot of politics related issues as well. But it was really interesting to learn about it in different areas as well and how they've been persisting them throughout most of the time in modern civilization, yet we haven't really done much about it. But there are a lot of organizations that do and try to help, so it's nice to know that as well. But I think it would really apply to local and wider geopolitical politics relating to the food issue, as well as a lot of humanitarian issues, just going through we're all right now. And it's really interesting to see a larger, more like top perspective on it, because you're not necessarily taught like any direct class on it. So it's very interesting. I learned how to avoid diabetes and how much sugar everything contains. Is there anything in the class that you learned that you applied to your life? How expensive food is, and like how a lot of food is unhealthy for me. Or most of what I've eaten before was unhealthy for me. And what was your favorite part? I guess that my favorite part would probably be like knowing how to afford food or how to like budget for food and like not to go to the store when you're hungry because you should buy random stuff. From the nutritional leadership is how to keep a good diet. Me, I play soccer, so I have to keep a good diet. I learned that some of the things that I used to eat were not good. And after the nutritional leadership, I learned more about how to keep my diet good, when I'm on the field, when I'm off the field. And that's pretty much it. I recommend everybody to do it. Keep a good diet and
I hope these videos help you become more aware of how powerful nutrition can be, especially when we start building healthy habits early in life. Good nutrition isn't just about eating fruits and vegetables. It's about understanding how the foods we choose affects our energy, mood, focus, and long-term health. For young people, these choices are especially important. The habits formed during childhood and adolescence often shape how we eat and live as adults. When you learn to make balanced food choices, you're not just fueling your bodies for the day. You're laying the foundation for a healthier future. Proper nutrition not only prevents chronic diseases, but also supports mental health, academic performance, and physical development. The younger generation is showing remarkable proactiveness in applying what they've learned about nutrition to their everyday lives. From choosing water instead of that Starbucks Frappuccino, to incorporating more vegetables into their meals, and even encouraging families to cook and eat together. These small, thoughtful actions are creating meaningful change. Each step, no matter how simple, contributes to a healthier, better lifestyle, and it sets the stage for long-term well-being. Nutrition is a lifelong journey, and it's never too early to start. We hope these stories encourage you to think about your own eating habits and inspire you to make choices that support your health and well-being today and for years to come. Thank you so much.
With all these technical troubles, so I hope that you guys still were able to learn something from Miss Anna's speech. And if there's one takeaway, it's that small choices, no matter how insignificant they may seem, they can lead to better health outcomes. So, like you said, switching out that sugary sweet drink for maybe a water, or maybe trying to incorporate more fruits, veggies, all of those things, small things, they all add up in the end. So once again, Unparalleled Troubles. And next up, I believe we have our speaker, Cynthia, which will be introduced by our alumnus.
Ira, are you here?
Oh yeah. Sorry. Hi guys. Today I'm gonna be introducing Cindy. She is a assistant program specialist for tobacco control and prevention program. She's a unit manager for community engagement and clinical prevention units at Los Angeles County. She led efforts in chronic disease management, diabetes education, harm reduction, and tobacco. Her background includes clinical program development, staff and patient education, and research coordination. She continues to be a leading voice in tobacco control across Cynthia, sorry.
And I have a slide deck that I don't know how to get to. A slide deck? It was that white blue one.
Like fake. What's it? Which one?
Oh, that one, the blue one. So, can I have a slide presentation if you want this? And then,
You just have to click.
just click this, okay.
Or like the next one. There's like the previous one.
Okay. All right, I'm technologically challenged, so please be patient with me. So my talk is on vaping and other tobacco products. And everyone always wants to know what's the big deal about it, why are we so concerned about it in the tobacco? So this program is to describe how tobacco and vaping industries target youth in product development and marketing, explain nicotine addiction and dangers of using nicotine-containing products as well as other vape products, discuss why people vape or use nicotine pouches, and describe what you can do to prevent your peers from using tobacco products or to help your peers quit. So the big question is, why does the tobacco industry target youth? It's all about the money. It's profits. If they can get people started vaping or smoking, they're going to be able to bring in a lot of money. And so if we look at, okay, the advertising and marketing costs, it's 8.6 billion that the tobacco companies are spending just on advertising and marketing. But if you think about it, the whole tobacco market value is about $78.6 billion. And e-cigarettes and vaping products values are approximately $8.98 billion. So it's big money. Now, to understand why this is so significant, and I have to stay here because I'm forwarding this. In 2002, our smoking rate, oops. All right, I don't know where this happened here. Nope, I'm going in the wrong direction. And it erased, in 2002, our smoking rates are above 14%, and that's out of 10 million people. Our current smoking rate now is at 6%. Now, if you look at this as just revenue, that means that there's a lot less money coming into the tobacco companies. And this is why there's this big push on e-cigarettes and other nicotine-containing products. Why do tobacco companies target youth? And believe it or not, we have found e-cigarette devices in 3rd and 4th grade in the elementary schools that have been turned into the Los Angeles County of Education. So they're starting young. It also is very prevalent with middle school and high school students. So youth are the replacement generations. They want you to become addicted to the nicotine. For all the smokers who have died or who have quit smoking because they're losing their consumer base. The strategies that tobacco companies are using are flavored products. And, the bathrooms in the high schools when this stuff first started were the best smelling bathrooms in the world. They used ads, social media, contests, product placement in social media, movies, and gaming. They gave out free samples, coupons. They encouraged local retailers to offer perks like student discounts on these different products. They had great merchandising with company logos, and they used celebrity or influencer endorsement. One of the latest tricks that the tobacco companies are using is they're saying that vaping is safer than cigarettes. Harm reduction is the newest tactic that they're using, and a lot of people are falling for it. Why do people vape? In the little group that I had earlier today, they're doing it because of peer pressure. Everybody does it. All my friends vape. I want to fit in. I want to have a really good time. Also, when people are bored and there's nothing else to do and they see all this hype about vaping, they want to give it a try. And that's when they go to their friends, get a hit. Vaping helps me to relax. I want to feel good or get high. The flavors taste really good. And the flavors that are on the market now target young people. Vaping is more convenient than smoking cigarettes, and it is safer. And so it also helps me to quit regular cigarettes. And so now I just vape. I can't stop.
I feel lousy if I stop vaping. And this is where the nicotine salts come into play, or the nicotine. This is nicotine addiction, and it's a physical addiction. So what's in the e-cigarettes and the e-juice? And they're saying it's so safe. We know the liquid part of the vape juice is propylene glycol, and that's a form of the antifreeze that you see in cars. Vegetable glycerin gives a big, huge white vape cloud, but it allows for smooth vaping or smoking. It carries the flavor, color, and the nicotine salts, but it just kind of smooths it all out so you can bring that vape in. The active ingredients are nicotine salts, and I repeat again, it's the nicotine that's causing the addictions. Flavorings, that's what attracts the young people, and then there's certain additives that have been added to enhance nicotine absorption. So this is a poster that we use, it's very common. These are all the chemicals that are put in cigarettes to help enhance nicotine absorption. So ammonia, remember they talked about environmental pollutants? Formaldehyde, lead, methylpyrene, arsenic, propylene glycol, methylpyrene, turpentine, acetone, cadmium, benzene, butene. These are all chemicals that have been added in by the tobacco companies to get people to get addicted to the nicotine. And as time went on, when we first started seeing the vaping coming out on the market, we didn't know what was in the solution. But as times have passed, if you'll notice, it's the same chemicals that have been added into the vaping solutions. And again, it's to get people hooked on these tobacco products. So additives are in the nicotine containing tube because it helps to the nicotine to absorb more quickly into the bloodstream. It helps people to breathe in and hold smoke or the vape deep in the lungs, and it changes the physical properties of tobacco, smoke, and vape so nicotine can be carried deep in the lungs. It allows the feel-good neurotransmitters to stay in the brain longer. But my animations just aren't working. This is the pathway to a lifetime of nicotine addiction. And so where does nicotine come from? Back in the day, 15 years ago, the primary source of nicotine was coming from tobacco plants, and those are the nicotine salts. Since then, with the advent of the vaping devices, they're now manufacturing nicotine salts because it's cheaper. And I don't know why that's ringing. So these are very addicting chemicals that are here, and they look the same from the synthetic nicotine to the tobacco plants. They also now have nicotine analogs, and these are nicotine-like chemical structures that are very similar to nicotine. And the reason for these nicotine laws are to get around the federal regulations now with flavor bans and this type of stuff, so they won't fall under those regulations. But they have the same effects as nicotine. Hey, guys. I'm losing track. If you could. Oh, actually over there. Anyway, so it was mainly put into place so that we could get around the federal regulations. So what are the short-term effects of nicotine? Nicotine is a stimulant. It makes people feel more alert, more alive. They can see better, they can hear better. It's the foundation of it is adrenaline. The other part of it is the reward or dopamine pathways. And those are the pathways that make people feel good. Can I do this from here? Can I advance it from here? No, okay. All right, and then last but not least is learning. It actually, in some of the review of the literature, we saw that it improves short-term memory. And so people will tell you, I feel better, I learn better, and I feel good. I'm very alert and I'm very energetic. The problem is that it's highly addictive, and it's following the same pathways as other drugs that we see, where people become addictive. It has been for decades known that nicotine is as addictive as heroin. So once we can get people using the nicotine, we know that we have a consumer base that's going to be buying these products for a lifetime. Nicotine is a physical addiction. There are withdrawals. So if someone stops cold turkey and they've been smoking a lot, it's going to be very difficult for them to maintain that quit without nicotine replacement therapy, where we slowly wean them off. You have irritability, frustration, anxiety, difficulty concentrating, restlessness, impatient, depressed mood, insomnia, and increased appetite. And those are the common nicotine withdrawal symptoms. There was someone that came by the table that said that her dad smokes, and he's been smoking for 20 years. He's going to have a really hard time smoking just by doing it cold turkey. The success rate is not really high. Generally, we have to have people go on nicotine replacement therapy and slowly wean them off the nicotine to minimize these withdrawal symptoms. So how does nicotine affect youth and brain development? We know that brains continue to develop rapidly until about the age of 25, and that's the magic number. Each time a new memory is created or a new skill is learned, stronger connections are built between the brain cells. Young people, you all learn more quickly than us, the adults, because the connections between the brain cells occur faster in young people's brains than in adult brains. Oops. So in the developing brain, if you expose that brain at a young age to nicotine, it will affect the part of the brain responsible for attention, learning, and memory. And so what happens is that people have to have nicotine continuously coming in so that they can maintain their attention. There's worsening anxiety, irritability, and impulsivity. And being a teenager isn't just that. It actually worsens all of this. And it can lead to long-term effects on the ability to make decisions and increases the risk of addiction to other substances. So the effects of nicotine on a young developing brain is really catastrophic. Long-term or e-cigarette effects that we're seeing on other body parts are the lungs. So we know that the vaping solutions cause local inflammation and can cause injury to the lungs. For the heart, we've seen some studies and cases that are coming out now that they're having heart failure. The heart muscle becomes stiff and doesn't fill properly with blood. And I just talked about all the brain effects, but more importantly, we don't know what the long-term effects of e-cigarette use or using some of these other products are going to have on your body. Combustible tobacco products, we all know cigarettes and we all know that cigarettes kill. One pack of cigarettes is equal to 22 to 36 milligrams of nicotine. Only 1.2 or 1.8 milligrams of nicotine into the body for each cigarette smoked. But what I want you to draw your attention to is this range. We're seeing a tremendous difference from 6 milligrams to 28 milligrams, depending on the type of cigarette that you're smoking. There's one cigarette, I can't remember the name. It's a Nature Spirit tobacco, has a lot of nicotine that's in it. And they call it organic and they call it better to you, but it's not. It has a lot of nicotine that's in it. An average pipe has 30 to 51 milligrams of nicotine. And that's equal, if you look at that one right over here, that's equal to about a pack of cigarettes to a pack and a half of cigarettes that you're getting in if you smoke a pipe. And that's just with one bowl of the tobacco that's filling the bowl. A large cigar has 13 to 15 milligrams of nicotine. And that's about a half a pack of cigarettes to 3/4 of a pack of cigarettes. And cigarillos, which there's flavor bands on it, we still see it being sold out on the market, and it has 100 to 200 milligrams of nicotine. And so that's about 4 packs of cigarettes with one pack of the cigarillos. Hookah, 60 minutes is equal to 200 cigarettes, a huge amount of cigarettes. And so that one is going to be 5 packs. Some of the other vaping products, and I'll tell you now, I put this talk together at the beginning of the year. We've seen a whole bunch of other vaping products that are coming in, but we have Elf Bar, Esco, Juul, Mr. Fogg, Views, and then of course we have the mods. And the mods are the ones that are creating a lot of problems because you can add vape juices to it, but it also has a voltage meter on it that can heat up the e-cigarette solution. And that e-cigarette solution, if you heat it up, means that you're going to get more and more nicotine to cross into your body, up into your brain. So the mods are a really big problem as well as some of the other products. There are heated tobacco products, and these products you stuff with tobacco leaf. It uses tobacco. It heats the tobacco leaf, but it does not burn the tobacco. It's actually a hybrid of cigarettes and vaping. So it's not safer and it's not better. Other type of nicotine e-cigarette devices, I don't know if you've heard of geek bars. They have 15,000 puffs, but it's actually equal to 40 packs of cigarettes, and that's one unit. The other one is, and I can't see, a flume, and that's equivalent to 37.5 packs of cigarettes. So it has a lot of nicotine that's in it. Again, if you're giving people a lot of nicotine, they're going to become heavily addicted to tobacco products. Nicotine pouches are now the latest thing that we're seeing that's showing up at schools. There are 3 milligram and 6 milligram concentrations of nicotine that's in it. One pack from the 3 milligram side is equivalent to, and I'm doing the math very quickly, like 1.25 packs of cigarettes. You double that for the 6 milligram, and you're looking at about 2.5 packs of cigarettes. So it's a large amount of nicotine. Health vapes have the same liquid solutions that we see in the regular e-cigarettes, but we don't know what vitamins, melatonin, caffeine, chamomile, and all these other healthy things that they say are in it. We don't know what it's gonna do into your lungs. We're gonna have to wait 10, 15, 20 years to see what the long-term effects are. Vegan vapes are generally having the propanediol, which is made from fermented corn, but we are still seeing that there's a combination of propylene glycol, the antifreeze, and propanediol in those liquid solutions. They use vegetable glycerins and they use a blend of botanicals that are supposed to be healthy. Again, we do not know what it's going to do in your lungs if you vape it. It's not, we don't know if it's safer. Odds are it probably is not safer. The key takeaways for this talk are that tobacco companies are only interested in making money. Any product containing nicotine is highly addictive. Nicotine is poison to the developing brain and can damage the lungs and heart. Health vapes and vegan vapes are not safe. And I implore you, don't be a part of the guinea pig generation. Don't be a part of the group of kids that we're going to be looking at in 10, 15, 20 years to see what the long-term effects are. Support your peers, friends, and family to help prevent or quit tobacco product use. And we want you to be an influencer, the same way the tobacco companies are. Be involved in the development of school policies and future public health policies, and it sounds like you're already doing that. And the other thing is, we know why people are vaping, and we're asking for you to provide peer support to prevent tobacco product use. Again, my animation didn't work, but you are powerful, and your peers will listen to what you have to say more so than what they'll listen to me say. And I'd like to go ahead and thank you for your time. That's it. Do you have any questions? Put it in. Any questions? Yes. Like this.
So I take like this survey for my school. Okay. Thanks, Sophia. Okay. Oh wait, hold on. I can't turn it on. Oh, it's a thing. Okay. I take this like USC survey for my school before, and they ask about like tobacco and drug usage in my generation. And so one of the things I've seen come up in the survey is the use of like nicotine flavored gum. I haven't heard that before, and I want to look into it, but I keep forgetting to look into it. So could you like tell me about that, if it's like better or worse?
They do have some nicotine gum that comes from Lucy's. It's an English product. They're marketing it like it's FDA approved for use, for quitting tobacco use. The problem is we don't know how much nicotine is in those products. They're flavored. What happens most of the time with some of these commercially available products is that there's no weaning protocol that's in place. So all that they're doing is they're changing it from cigarettes or vape to the gum that you're talking about, the flavored gum, to keep the nicotine levels high in their body. Is it successful in the long run? No, people tend to stay on the gum. It's one of the problems they've had in England, where there's no protocol to wean people off of it. But yeah, it does exist. It is available. You can buy just about anything on the internet. I go on Amazon, I just go and look and see what I can buy. And a lot of the stuff that they say is not available in the United States, you can buy online. The checks that they do for y'all when you're purchasing any of these products, they just have a little thing, are you over 18? And if you click yes, you're in and you can buy it.
Thank you.
Yes.
So actually, it's kind of similar to what she just asked, but like you talked about the sins and everything and helpful is quitting. So how true is that? And kind of like, again, like you mentioned, kind of like with the gum, like is there that same problem?
It's not true. And let me go back to over here. It's got a lot of nicotine that's in it. So all that you're doing is you're transferring that nicotine addiction to another product. All right. So unless someone is on a protocol to decrease the amount of nicotine that they have going in, they're not going to kick it. Now, kind of an indirect answer to that question, the best way to get nicotine into your brain is to freebase it or to smoke it. If people stay on this, eventually they're going to find out that that's not going to work so well, and eventually they're going to move back to cigarettes or other products that you smoke because it crosses over into the blood-brain barrier more quickly than when you chew on it or even when you're vaping in it. Does that make sense?
That makes sense. I just wanted to clarify, since
Yeah.
we always kind of like, there's a bunch of random ads online now, and so I think it's good to clarify, to make sure that we understand what is true and what is not true.
Yeah, they're using, and this is what's so diabolical about the tobacco companies. They're using harm reduction as an argument for the products. And if, we talked about nicotine addiction, once they get you on it and they get you with that physical dependence, you're not gonna be able to get off of it easily. You're gonna have to go into counseling. You're gonna have to go on medications to help get off it. And that's where the problem is. They're trying to build that consumer base because frankly, a lot of the old folks have died or they've quit, but mainly they've died. And so now we need more people. They need, not we, they need to have more people who are willing to buy the products. And this is a good introduction to get people to do it. And that's why we're so concerned about it in the tobacco control world. Stop. Got it.
Okay. Oh, wait, okay.
Oh, okay. Yes.
Yeah, we were just wondering, because some of us have to deal with or some of us deal with family members or people in our close community, they deal with, addiction and struggle with it. We're just wondering, what is the quickest way to let people know about the harmful effects of smoking in a family or community setting?
I would tell you to show compassion when you're talking to them about it, because it's not just a choice, it's actually a physical addiction. I would bring them literature and I would talk to them as to why they're smoking. My dad was a heavy smoker and he smoked when he was under a lot of stress. So our focus had to be on working on stressing or coping mechanisms. If it's for your peers, it's to help them understand that you don't need to vape or smoke in order to belong. You belong irregardless of that. So it's really dependent upon why they're smoking. But I urge you to use compassion. We can't pass judgment on people who are using tobacco products. Was there anything else? I see one hand in the back.
So my question is, how do we advocate as like the accurate effect of e-vape, e-cigarettes and vapes, as we don't have the accurate data now, but how do you advocate that to let people quit those like alternatives of traditional cigarettes?
That's a good question. And this is what the problem is. Cigarette smoking, before doctors used to push it as a means for people to relax. And they push it as a way to deal with stuff so you wouldn't drink alcohol and take in other drugs or medications. I tell people we don't know what the long-term effects are. This is so far what we're seeing. And I ask people, it's my eye is going to be on you as a healthcare professional to see what's going to happen in 20 years. So we don't know. And since we don't know, why take that risk?
Thank you.
Thank you. Thank you. Thank you. Okay. Yes.
I activated a. I activated a.
So we're gonna take a quick break right now and we'll be doing the game show, which I believe some of our other youth volunteers will be leading. So can you guys come up? In the meantime, while we're doing this break, we'll have the tech team try and fix some of the technical issues that we've been having. So I head it over to our entertainment leads.
Yeah. Yeah.
Are you gonna put it up? Are you gonna put the Kahoot up?
Kahoot?
Yeah.
Sure. I don't think I received it to put the game show. Is this sent to like an email at the time?
Yeah. One time. He said that.
Oh.
Oh.
Or is it there like a game show slide? Is it part of the main It's
Not the Kahoot account, but it's driven on there.
that's the main. Kahoot account?
Well, it's under. What someone told me was that they made the account official. It should be on the slide somewhere. Right here, right here. That one.
Yeah, but I don't have the account, so I need to sign in.
Wait, can you click the link? Oh, that's.
Because I don't have the account. Yeah, I think it'll ask for you to like sign in.
Yeah.
We not. So you have to host it. Okay, once we join, do we still need that big screen or no?
Yeah, because the options are gonna be on the screen.
Yeah.
That's what the issue meant. You could bring it here and
Can't see the slides where we have the speaker's email. I just want to have the.
you can.
It's there.
Oh, shit. Okay. No. Okay. It's on there now. That's like anything works. Wow, this is a very long charger. I'm just gonna. Okay. Not with that.
I'm starting to shoot that. How long? I'm still under. And ACS-YA is on the chair.
No, because this has to be over here later. Yeah.
So you go to the blue dot on your phone or whatever browser you have, and then you enter that code.
Could you connect to the editor?
And QR code.
Connect. That's another one.
Name. Yeah, so make sure to put your name so we can roll with so we can award you surprises after your show.
Oh.
So I didn't skip.
Yeah,
I'll do one. Guys, so please use your real
So
name.
can I have
so we
permission
can,
to touch the computer?
directly award you.
Thank you. You guys probably did it already. I just want to make sure again.
That's okay. You wanna?
I need the
Setting?
I think. Thank you. Am I blind? Something I can't see your point.
Right point of view. But where cursor go?
You're not projecting.
It's not. Yeah, so it's not on the main screen. They just disappear.
Yeah.
Wait, oh, okay. No, because it is
Oh, it's
just because yeah.
never mind. Yes, okay. So you guys attach it to this one, right?
Huh?
You attach it to this one?
Yeah.
Okay. We.
Please join in.
Yeah.
What's the remote of the projector?
What? Oh yeah.
Did you guys try it?
I didn't know how to work it.
Okay, so the volume over here. So that's probably one. Well, we'll find that out on their pins.
Yeah. Oh.
So this is the volume over
Yeah.
here.
Okay. Oh, so this connects to the speaker.
Yeah.
So they're on the
That's
event
cool.
right before our interview, so this one's probably gonna take another 20 minutes.
I'm,
I think the Zoom,
I'm,
are you in the Zoom meeting?
yeah, I mean, I can hear them. I don't know what they're doing.
Okay.
President Darn.
Come up to them, they can
Bro.
with whatever, like, the entire day, so it might not work at first, so
Darn. No, it's nothing. It's nothing. Darn.
you know, take note of that.
Someone said.
Yeah, it's gonna come up soon.
Go.
20 minutes?
Yeah, about 20 minutes.
Okay. Sounds good.
Okay. Bye.
Uh, 5 minutes. 5. Oh, we can't do that. There's another one. Dude. Because this is not connected to the Zoom. This is connected to the screen. So there's some people online that want to do it. Yeah, but I don't. Oh, I think it was, yeah. Yeah, I did it.
And type like.
Yeah. I'll just copy and paste. Yeah. Here. So. There's speaker volume. Yeah. Because it was working, but it was so quiet, right? You couldn't hear him, yeah. I didn't know.
So this is for the
Yeah.
because they said they don't need it early.
Right?
Yeah.
Oh.
You starting the.
Recording in progress.
Oh, okay.
We could have gone through this before the.
That's fun.
By
I
the
wasn't
way-
here, so I wouldn't.
Where's the camera?
Oh,
Did they get it yet?
think they're in. Hold on, I need to check. Oh, shoot. Yeah, this is chat.
Wait, which one?
Or it's going down. Sorry, girl. Sorry.
Hold on. I don't think they're looking at the chat. They can't talk like that. No, because like, okay, one person did, one person in chat, and that's. But I can't like talk to them in the Zoom.
Is there any way we can?
Have a mic.
We're gonna look again. Attention fan.
This thing is a fucking pitch.
Hello. Thank you. Are you in the Kahoot yet? Tom?
Hello?
Yeah.
Say that again?
Are you in the Kahoot we're doing?
I see it, so I'm just supposed to log in.
Log in? Oh, you have to go to kahoot.it, the website, and then there should be a place to put the code. And then I put the code in the chat.
Okay.
Turn. Check this.
Right.
Yes, madam. He did 303 now.
They win, how do we give them the prize?
Oh no.
Oh, I mean.
Alright.
Like,
We should get started.
it started.
What happened there?
Now everyone, we're starting now, so please help look at your screens. Good luck.
Wait.
So which of the following
Have they
statements
written
about
this?
baby is true?
Oh no, they have on their screen. They can see the question.
They don't have the. They don't have the options.
Hello?
Oh, they can see the actual name, can they? No, they
only
it's
can see
the
the-
letters and
yeah.
but they can't see the
Yeah, that's-
answers. Oh, bro.
Hello?
So
This is not connected to the Zoom.
Oh my god. Yeah.
We can't see anything. We just see the
Yeah,
log
we
into
can't see
into.
the questions of the answers. Bro.
figure right cause of the difference.
Wait, hold on. 'Cause it's do that again, though. We have to like remove this, put this in there. Oh, bro. They're just they like. It's just,
You need to connect to the Zoom. For the. Just share the screen.
It's still frozen. That's what I'm out saying.
So what happens within 20 minutes after quitting smoking?
Okay.
Just
press like right there and nothing to like. Okay, can you tell someone? Yeah, just stop it. Yeah.
3-7.
No worries. I need to invite behind it.
No, I mean, can't just live in the Zoom and work free. Oh, so then you can switch back to there. I said the whole thing aside. My computer is not the host. No, you are the host. I mean, the host.
Hello?
Oh, host. Yeah.
Yes.
Do I put the code into the chat on Kahoot?
Yeah, I just put the code in the chat so that everyone can get it.
I would have just
If it changes from setting, you can actually see it. You don't
Is Angela or Sophia there?
You guys.
Did that work?
I am checking with that.
Yeah, we just needed to join the 33.
Oh, I think yellow. Done. You're right.
I guess like positive thing. We need to have it join. So like, just stop drinking next.
Hey, give us a second, we're experiencing time dance. It takes like a lot.
Made that happen. Like 5. I should say 18 plus.
Can the speaker
Restart it. If you get like if you run for strong, you can't get there. So virtually Zoom, they can they can like you're cute. They can actually because this thing is not connected to the server. You can't see the answers. Yeah.
Hello, everyone on the Zoom. Is the code working for you or no?
So it's like
The code is working for us, but like we can't see like the answer choices or like the question itself. So we kind of like on that situation.
Let me talk to me coordinate.
Should yeah.
No, somebody the website, everybody, join the room. And share it with free. This is the time. Oh, hi.
Okay. So maybe people are like they can't. You got it right next to
Yeah,
so it's like no, like 4:30.
The speaker, can I get to Angela and Sophia for a second? Sophia?
Okay, Darren, I'll say that to them. I'll say we are going to broadcast the screen.
Wait, oh wait, you're still connected to it.
What?
Wow. This is not connected to that. You can't like swap it here.
No, say something. Just say something.
So what?
Like
Doing something.
no, go ahead and share something.
Yes, and so just get other people on the Zoom stuff.
Okay, everyone, we're resuming now, so please, switch back to your data. Recently, it's no beyond
I think it's yellow.
It's yellow.
Yellow.
Oh. Oh, can you hear us right here? Yeah. Oh, I think it's red. What are you doing?
Hello.
Hello?
Are we taking a break or is it just tech difficulties right now?
Yeah, I'm not sure. I think they're trying to figure it out.
Okay. So, okay, yeah, I just got the text them. They're just figuring out the difficulties. So I guess for right now, we're just gonna we're just gonna wait for them to resume the conference. So
Sure.
just sit tight.
Thank you. Digital wisdom tells us physically, pedigree wise. Vince, what's up?
I think a little. So, are you in the Zoom? I know they changed the meeting room or whatever.
Yeah, I mean, they're just like I'm in the Kahoot. I went in there, put one of the girls, and she said they'll be back with me. So I'm just waiting.
Are you in the Zoom group
Yeah,
by yourself?
I went Zoom and I went to Kahoot.
In Kahoot, that has nothing to do with.
That's what I was told to do.
No,
So
are you in? Did you hear anything?
we're having some issues. We'll be right back with you.
Having tech issues with they're currently working on it. So, and I don't know. I haven't
No,
got to
the Zoom
anyone.
is live now, so you can just see the screen share, and then you can see like the Kahoot going on right now.
Yes, like now it's good. I was just talking about before.
Yeah, but
Have you tried joining the link again? Try joining the link here.
just the Zoom link.
Yes.
She believes in integrating conventional and alternative approaches to enriching wellness. Through conducting workshops, education, and community engagement, she hopes to inspire women to prioritize their health with confidence and resilience.
Okay, well, yeah, I got the cameras on. I can hear stuff, so everything's ready to go.
Create an effective program focused on compassion.
Right on, brah. Later, brah.
Unity and accessibility to create a positive impact on health. She believes that by involving community, we can create a more inclusive, effective, and sustainable approach to health promotion and disease prevention. Please welcome Dr. Apurva.
Thank you all for having me here today. I'm going to start off by correcting, I'm not Dr. Apurva. Okay. I'm something you call a CCRP or a certified clinical research professional. So today I'm going to tell you the story of my journey in this career path. This is a story and a fact of curiosity and compassion, along with a really, really strong passion to make a difference and empower women to take control of their own lives. I started off my education and journey in India. I studied in the University of Bangalore in microbiology, genetics, a little bit of chemistry. And then I moved here and continued my education in enzymology and genetics. Went ahead and got a master's degree in public health from USC. So this has been my academic journey. However, I've started working in Quest Diagnostics and started with lab work and eventually moved on to clinical trials. And that became my life's work over the last 20 years. So currently I work as a CCRP, as a research professional in women's oncology at Norris Comprehensive Cancer Center at USC. My job is at the intersection of science and data and everything. It comes back to compassion and actually caring for the person that's going through the disease. And this is where community plays a very big role. And this forum is so important because we have so many diverse communities. And we do have people that seek comfort and solace within their community because many of us are immigrants. And this is where my work with SAHAS comes into play. I volunteer my time as a public health programmer, mentor, as well as work with youth to empower them because education is what leads to knowledge and change within the community so that we can have a measurable impact for whatever's affecting our community and make a difference to not just our community, but spread the word around to other communities, which is why we're here today. I would love for my colleague here, Krish, to take over and talk a little bit about our work at SAHAS.
Hi, my name is Krish, and today I'm going to be talking about what we do at SAHAS. And first, we help the South Asian community by helping out our older adults. We have a tech class, and through that, we teach them what to do with their phones. If they have questions, they come every month with questions on if they don't know how to download an app, if they don't know how to message someone, we help them with that. And then we also have a youth chapter through that. We have a public health chapter there. We we write grant proposals And through that, um, we do outreach so we can spread the idea of helping out the South Asian community. And we also have a research chapter, and through that we help South Asian community so we can find ways to help them. And then we have a DARPA project, and there we also do, it's kind of similar to public health, but we also help South Asian community through that. Thank you.
So through every role I've played in my career, one of the most valued, one of the values that remain constant is compassion with purpose. And science gives us the tools to understand what a disease is. However, our compassion gives us the courage to confront the disease. And this is true in the case of not just cancer, but every disease. And as we look forward into the future, I hope to continue merging scientific training as well as my advocacy for health to build programs that are more inclusive, accessible, and rooted in empathy. Because the goal of research is not just to publish data, but to change lives. Thank you all for allowing me to share my story, and thank you for everyone who continues to believe in the power of research, resilience, and compassion to make this world a healthier and kinder place for everyone. And the very fact that you're here today shows that we have taken the first step together. So congratulations to all of you.
Okay, so just a quick announcement. We have a little bit of a change in plan because one of our speakers cannot make it today. So we will be skipping over one of the interviews and we will go to the one for yes, for Tom. Vincent is the one who's introducing. Oh, perfect. There. So.
Hello, everybody. I'm Vincent Fritchie. I'm a youth ambassador for the AYCS at the college level. I'm currently a sophomore in college, studying biomedical engineering. I have a passion for healthcare, and I plan to have a career in the hospital field. And today I will be serving as a youth leader interviewer, interviewing Thomas Fritchie as a respiratory therapist.
Hi, you guys.
Can you just get him on the phone?
Can you guys hear me?
On the screen. How do you get him, dude? No, we can't get him on the screen. Then...
Yes, we can hear you.
Okay. Should I start?
I'll ask the first question.
Okay.
So could you please introduce yourself and share your current role in healthcare?
Yeah, hey, I'm glad to be here. Thanks for having me. My name's Thomas Fritchie. I'm currently retired after working for 21 years at UCLA Medical Center as a respiratory therapist.
Hold on, wait 1 second. They can't hear you.
Yeah.
We have to disconnect this. Where is it? Try it. Okay. Wait. You tell him to try to say something?
Can you try saying something?
Hey, this is Tom Fritchie.
Yeah.
It's still not on the speakers. Hold on.
Wait.
I just connected the video earlier.
Oh, and we just did speakers. Yeah. Oh, hold on. Speaker. Like this. Yeah, I think that should do it.
Can you try saying something?
Hey guys.
Okay.
Okay. Hold on. Can you try one more time?
Yeah, hey, I'm glad to be here. Thanks for having me.
All right. So can you just reintroduce yourself and your current role in healthcare?
Yeah, thanks you guys. I'm really glad to be here. Thanks for having me. My name's Thomas Fritchie, and I'm retired now. I worked for 21 years at UCLA Medical Center in Westwood, and yeah, I'm retired now. So
Okay. So second question, what inspired you to choose a career in healthcare and how did you know that this was the right path for you?
great question. So originally in college, way back when, I was a science major. That didn't work out completely. I knew I loved science, but I ended up moving on to English and I graduated with a degree in English. But I knew that I always did like science. After college, I worked at a bank that our main customer was the nearby hospital. So for 5 years, I was dealing with all these hospital people, doctors' offices, cashing their checks, and they did pretty well. Um, and I just realized banking wasn't for me. So at that point, I decided that I wanted to get into the medical field. So I went back to college and I took a summer class, chemistry, and it went really well. And so after that, I decided to go back full time, and that led me to Santa Monica College, where I took the first class, and ultimately led me to East LA College and the respiratory therapy program. And after finishing that program, I was hired at UCLA. Um, it's what's interesting is if I had not worked at that particular bank next to the hospital, I may have very well never have gotten into the medical profession and I wouldn't be here today. So it's strange how things work out. As far as the right path, I didn't really know if this was the right path for me, but I trusted my instincts. Again, I knew I liked science and it worked out pretty well.
Thank you for that. So the third question is, how did your career pathway unfold after your initial training and what different directions can someone take in your field?
Okay, so after my initial training, which was like a 2 week period, I went to the night shift, which is 7 p.m. to 7 a.m., 12 hours. So that was pretty crazy. But I was glad to do it. So at that time, I was trained in each ICU. So UCLA has a lot of specialized ICUs, and they train us through all of them, except neonatal if you don't want to do that. Anyways, so each unit has its challenges, but the neurotrauma unit and the liver transplant unit, those are more straightforward. So that's where they started us out. After that, I went to MICU, which has a lot of pulmonary patients that are very ill, very sick. Next was cardiothoracic ICU, which is incredibly busy, incredibly demanding, learned a ton. You're basically admitting patients out of surgery that have had bypass, heart bypass surgery, aortic valve repairs, replacements, mitral valve repairs. There's a whole host of surgeries they have, in addition to heart transplants and lung transplants, both single and double lung transplants. So, and then from there, I went to pediatric ICU, which is completely different. Children are much, it's a different world. And especially with babies, things happen quick. It's completely different. And then from there to the ER, the emergency room, and you have to have done pediatrics because you're going to get pediatric patients in the ER. So that's why they have that last. So I was on the night shift for 9 months. And then luckily I got a chance because I was having trouble sleeping during the day. And I got a chance to go to day shift, and I spent the next 20 years on day shift and retired. So, and then from 2010 to 2020, I worked on the transport team. So we would go to other hospitals, pick up patients there, and bring them back to UCLA for a higher level of care. Sometimes we would take patients to other hospitals, but normally we'd go pick up patients. One time, one transport was particularly harrowing. It was we had to go to Ventura, and this patient was extremely sick, and it was just me and the nurse, and the patient almost didn't make it, and that was pretty scary. We got back to the hospital. Patient did make it, fortunately. So that was pretty crazy. But in 2020, right when COVID hit, they required that we were going to fly in a helicopter as well. I just did ambulance before then, and I was not ready to do that. It's just not worth it to me. So I then left the team, and then my last 3 years before I retired, I was just back in as a regular staff therapist. I think that's it.
All right. And for our fourth question, and most likely our last, what advice or insider tips would you share with students who are considering a career in healthcare?
Okay. Well, actually, there was a little bit more to the last question, so I'm going to continue with that. The different career directions you can go are, as an respiratory therapist or RT, is you could be a NICU specialist, transport RT like I did. You can get into management, teaching, home care, where you go into people's houses and give them therapy. You can be a traveling RT where you travel around the country, and or you can work through a registry like a lot of nurses do. So you'll
At time, so
Okay,
we're gonna
anyhow,
move on to the last question.
So in terms of you want to ask good questions, you want to have good critical thinking skills, be engaging towards people. You want to display that a real desire, interest, and have confidence and show your ability. Be a team player. Be patient, especially with patients and visitors. And you want to treat people like they're your family. I mean, it's a job, it's a lot of responsibility, and it's a privilege to take care of these patients. And I felt very lucky. And sometimes people treat other people not so well, and that it's just not tolerable in the hospital. And finally, be a patient advocate, looking out for the patient's best interest. So, I had patients that would need walking, and I would go find the physical therapist. I'd bring them into the room, go, we need to get this patient walking. So you have to be pushy sometimes, but it's really just in the patient's best interest. And you should, if you want to do things to get a good sense of the hospital, you can volunteer. So at UCLA, there's the volunteer program, and there's also a program called the Care Extender program at UCLA, which actually I did prior to working at UCLA. And those are really good because it gives you a familiarity with the hospital. And then, they're volunteers, so you're not getting paid. But many RNs, for instance, not really RTs, but nurses start out as nurse aides. So you can get a job in the hospital prior to, if you're going to RT school, you can get a job in the pharmacy or just something to get you in the door and get you familiar with the hospital. Thank you very much.
All right, thank you so much for taking the
Thank
time
you.
to share the journey
Okay.
with us today.
Bye-bye.
All right, thanks so much, Vincent, for hosting the interview with Tom. So we're now at about the time where we're gonna start wrapping things up. But before we do that, I hope you guys still have the papers from the very beginning, because right now I have 9 of these, and whoever else hasn't turned it in, the first 6 to give me theirs can get a special prize. So if you haven't finished it, please start reading and then turn it into me so that we can start handing out prizes. In the meantime, while you guys are trying to finish this up, I'm gonna call the people who already have finished it so that you can come and take a prize. You can just grab one of these boxes and you guys can figure out what's inside. So first up, Ray, Tino from Temple City High School. Can you please come up? Okay, thank you so much. Alright, I'll get a picture of you handing it to me the last one. Next up, Sammy Meng from Ahoy High School. Please come up. Sammy from Awesome. Thank you so much. Okay, next, Leon Jia from Walnut High School. Where are you? Okay, he will be back shortly. And we'll call him later. Okay, next up, Nick Zhu, also from Walnut High School. Come up. We have a prize for you. Thank you for completing the pathway. All right, next up, Daniel Pai. Okay, Pai. Okay, next up, Zhu. I'm so sorry that I'm butchering people's names. Thank you so much. Okay, next up, Sophia Liu from Mondstadt. Thank you so much. Awesome. Okay, and then Ray Tiet from LA County High School for the Arts.
Then next up, we have Sammy Zhang. All right, now let's go to the late submissions. Let's see, Yuning Huang. Okay, and then Anthony Wu. Okay, and then the name starts with U, and I think it's Chang, something Chang, SPHS. You. All right, and that's it. We do have, I think, yeah, four more. Two, four, how many more? Okay, okay, so three more. So anybody else would like to submit last minute submissions? Absolutely.
Anybody finish their paper, their passport?
Okay, if not, then we'll just wait until Leon comes back and then we'll get him here. Leon, get up here. You want a prize? Okay. So with that, that's pretty much kind of the end of today. And before we end though, look at the screen. Is this familiar? I hope it is because this is kind of what we went over at the beginning. So again, try and be more active participants in all of these kind of things, whether it's for this initiative or for other initiatives. Take a stance, be an advocate, be a leader. Okay. So yeah. Please complete the post survey conference, and if you still haven't joined, please join using this QR code. With that, I would like to thank everybody for coming here today and for all your hard work. And thanks for making this a successful event. I will hand off to Sophia, who has some words over. Okay. Oh, so all the adult advisors and volunteers you guys can come up here. We still have a lot of flowers, so please, each one of you can grab one for yourself. So yeah, or Claire will hand them out. And once we're done with this, everybody come up front. We're gonna take a group picture as a whole. Thank you.
4 stars. Collaborators.
Okay, everybody, can we come on together to take a group picture? I know we're tired. Let's just quickly take a picture and then we'll be pretty much done. Okay. That's fine. That's fine.
Get off the ground. Darren, get in the photo, right? Stop having not alive.
You guys can sit on your, you can sit in the middle.
Wait, your live stream is still on. Huh? The live stream is still on. Oh. Hello. Bye.
Okay. you guys sit here. Right next to her. That's why you go in the back. You are tall, you can kind of sneak in right behind Sylvia, and then do you want to here?
Hi, if everyone else on this, I think we can leave. So,
Bye.
so they're just taking info. Bye. Thank you for coming.
Wait. One, two, three. Cheese. One, two, three.